Welcome to the Kidney Transplant Program at Piedmont Transplant Institute, and thank you for your interest in living kidney donation. In this video, we'll discuss the benefits of living donor kidney transplant, the donor evaluation process, donor surgery, and post-donation care. We'll also discuss the paired kidney exchange program and whether this may benefit you or the person you would like to donate a kidney to. Patients with end-stage kidney failure have three options: dialysis, kidney transplant from a deceased donor, and transplant with a kidney from a living donor. There are over 100,000 people on the kidney transplant list in the US, and less than 20% receive a deceased donor transplant each year due to insufficient numbers of donated kidneys. Therefore, most candidates wait years to get a life-saving transplant from a deceased donor. Living donor kidney transplant has two major advantages. First, it can significantly shorten the time to transplant, limiting the duration of dialysis, or ideally helping a person to be transplanted before they even need dialysis. Equally important, living donor kidneys may last several years longer than deceased donor kidneys, allowing the recipient to stay off dialysis for an extended period of time. In this way, living kidney donors also help with kidney disease nationwide by reducing the numbers of people waiting for a deceased donor transplant. Kidney donation is not for everyone. To determine if you can safely donate a kidney, our team will do a thorough evaluation. We will assess your current kidney function to make sure you can live a healthy life with one kidney. We'll review your medical and family history to determine if you're at increased risk for developing kidney problems later on in life. For example, diabetes and high blood pressure are the leading causes of kidney disease, and you'll be screened for these conditions. We'll also screen for kidney stones, transmissible diseases, and cancer. We may do genetic testing if you are related to the recipient or have another close relative with kidney disease. Additionally, we'll look at your kidney anatomy and ensure that a kidney can be removed safely during a donor surgery. We'll also talk about psychosocial considerations to ensure that kidney donation is the right choice for you and that you have adequate resources during the donation process. Important things to consider include support during your recovery period, time off of work, transportation, as well as child and pet care. There are many resources available to donors, and during the evaluation, we'll discuss what options there are for help. More than 99% of living kidney donors never need dialysis or a transplant after donation. The lifetime risk of kidney failure in the general population is about 3%, and in donors, it's less than 1% because donors are much healthier than the general population. There is a slightly increased risk of end-stage kidney disease in donors compared to non-donors with similar health. It is incredibly rare, but if you were to develop end-stage kidney disease after donation for any reason, you would be prioritized for a kidney transplant. All of the testing done during your evaluation is carefully reviewed by our entire living donor team to ensure that kidney donation is safe for you. If you're approved as a donor, we will discuss options for direct donation and paired exchange with you. Later, Dr. Klein will discuss the benefits of paired kidney exchange. Next, we'll discuss the donation surgery. There are different surgical approaches to minimally invasive kidney donation surgery. These include laparoscopic or robotic nephrectomies. It's very rare to require an open nephrectomy where a larger incision is needed to safely remove the kidney. The best surgical approach is determined by your kidney anatomy and surgical history and will be determined by your surgeon. We will schedule your surgery when timing is right for you. You will come in for preoperative appointment within a week before surgery and come to the hospital the morning of your surgery. Kidney donor surgery takes approximately 3 to 4 hours. After surgery, you'll stay in the hospital overnight for observation. You'll be able to leave the hospital once you're walking, your pain is well controlled, and you're able to eat and drink fluids adequately. Risks of donation surgery are very similar to other abdominal surgeries, such as gallbladder removal. Potential complications include pain, bleeding, wound infection, urine infection, hernias, injury to other organs in the abdominal cavity, reactions to anesthesia, and blood clots in the legs. However, these complications are rare, and major life-threatening complications only occur in 0.01% of donors, or 1 in every 10,000. Your kidney function is expected to drop by 50% the day of surgery as one of your 2 kidneys is removed. The remaining kidney increases in size and function to compensate for this, and by 3 months post-donation, your kidney function will be approximately 65 to 70% of your pre-donation function. After your discharge from the hospital, we'll see you in 2 weeks after surgery, then again at 6 months, 1 year, and 2 years after donation to ensure your kidney function is stable and your blood pressure is acceptable. To optimize your kidney and overall health, we do recommend that you continue to see a physician for routine physical exams every year. Additionally, eating a balanced diet, maintaining a normal weight, getting exercise, and avoiding medications that can harm kidneys will ensure the health of your remaining kidney.
Welcome to the Living Donor Kidney Transplant Program at Piedmont. In this video, we are going to discuss paired kidney exchange. During your donor evaluation, we may recommend paired kidney exchange rather than direct donation in order to optimize the outcomes for your intended recipient. In this video, we will review the advantages of paired kidney exchange. As part of your evaluation, we will determine if your blood type is compatible with the recipient. Additionally, we will test for immunologic compatibility. The person who needs a transplant may have preformed antibodies against tissues that are not their own. Our immune system forms these antibodies when we are exposed to non-self proteins through blood transfusions, pregnancy, and prior transplant. If these antibodies are present, it can cause a positive cross-match, and the risk of rejection becomes too high to proceed with the transplant. Paired kidney exchange is necessary if you and your recipient are blood type or cross-match incompatible. Even if you are an immunologic match, we may still recommend paired kidney exchange. For example, we may be able to achieve a more optimal immunologic match and long-term outcome for your recipient through the Kidney for Life program. Additionally, there are other considerations such as age and size differences that may make paired exchange the more optimal choice. Let's review blood type compatibility. Donors with blood type O are the universal donor. They can donate to any blood type, O, A, B, or AB. On the recipient side, people with AB blood type are the universal recipient, meaning that they can get a kidney from blood type O, B, A, and AB. Shown is a graph of what blood group matches between donors and recipients are compatible. About a third of donors are not blood type compatible with their recipient. If you are blood type incompatible, or the cross-match between you and your intended recipient is positive, you can still enable your intended recipient to receive a kidney transplant through a process called paired kidney exchange. You would donate a kidney to another person in need of a transplant, and the person you are donating on behalf of, or your intended recipient, will get a kidney from a different donor that is a perfect match for them. Paired kidney exchange really revolutionized living donor transplant years ago. About a third of people willing to donate a kidney are unfortunately not a match based on blood type or cross-match, but paired exchange allows for the living donor transplant to happen. Living donor kidneys last longer, have lower rejection rates, and often are done much quicker than the time it takes to get a kidney from a deceased donor. What's more, paired kidney donation not only helps one donor-recipient pair, but every incompatible pair that ends up getting transplanted as a result of the exchange. You are not only helping your loved one get a transplant, but potentially many other people too, multiplying your gift of donation. As we have gained years of experience with paired exchange, we have learned that there are significant reasons to consider paired exchange, even if you are a match with your intended recipient. The reasons may be to optimize the success of transplant. We will go through some potential scenarios, starting with the most important reason, achieving a more optimal immunologic match. Using new DNA sequencing technology called eplet matching, we can optimize the immunologic match for the kidney recipient to lower the long-term risk of rejection. Chronic rejection is a well-known major factor that limits the number of years a transplant functions and is very difficult to successfully treat once it starts. If a donor and recipient have an optimal uplet match, there is a significantly lower chance of immune reactivity after the transplant. This reduces the chance of developing antibodies to the kidney that can cause rejection and chronic injury, which ultimately will help the kidney to last longer. In most instances, you can achieve a better immunologic match for your recipient with minimal extra waiting time, such as a few months. We can discuss estimated waiting times with you and your recipient based on your individual situation. Another reason to consider paired exchange is age differences. Older donors may enter paired exchange to get younger recipients a better age-matched kidney. A classic example would be a parent donating through paired exchange on behalf of their child in order to get a younger donor kidney for their child. There are also anatomical reasons to do paired exchange. Some recipients have calcified blood vessels that make transplant surgery more difficult. If your kidney has multiple kidney arteries or veins, this may make surgical risk excessively high or not feasible at all in one recipient. In this case, we would advise paired exchange in order to select a donor kidney with less complicated anatomy for your intended recipient to receive. Another consideration is size mismatch. Fun fact, our kidneys grow proportionally with our height, so in general, taller people have larger kidneys. Donors that are significantly smaller than their intended recipient may opt for paired exchange to get a larger kidney for the recipient. There are also some personal reasons why paired kidney donation may be right for you and your recipient. 3 scenarios relate to timing. You may be ready to donate and have an optimal time frame to donate, for example, planned time off work, but your intended recipient may not yet be ready for a transplant. Perhaps they are still getting tests to be placed on the transplant list or have a recent medical issue. In paired exchange, you can donate when convenient for you, even if your recipient is not yet ready for the transplant. Another scenario related to timing is when a person has more than one potential donor and may need a future transplant. The reality of transplant is that living donor kidneys can last a long time, 12, 15, or even more than 20 years. But many people, especially younger recipients, will need another transplant in the future. If more than one donor is approved to donate, one may give to the recipient now, and the other give through paired exchange so that the recipient has a kidney voucher when they need a future transplant. Another scenario is when you plan to be each other's caregivers. A common example is spousal donation. If you both have surgery at the same time, you will need several people to help you both while you heal. Some donors opt to donate first, followed by their recipient surgery once they heal, within 2 to 3 months of their donation. In this way, you can care for each other during each person's healing process. The last situation where paired exchange is used is with a process called remote donation. Remote donors are donors that live in another area of the country and want to donate on behalf of a patient here. The remote donor can complete the donor evaluation, surgery, and donor follow-up at a transplant center close to them that participates in the paired exchange program. If compatible, a remote donation can be done where the donor kidney is shipped to Piedmont and directly transplanted into the recipient. If the donor-recipient pair chooses paired exchange to optimize the donor-recipient match based on the factors we just discussed, then paired exchange is performed. To recap, paired donation can benefit both groups, donors who are incompatible with their intended recipient, but also many other donor-recipient pairs. We can help optimize the amount of time the living donor kidney functions by achieving a better immunologic match, or the Kidney for Life program, and by addressing any significant size or age mismatches. Paired exchange can also allow for the donation and transplant surgeries to happen at a different time, allowing people to be each other's caretakers, or allowing a donor to have surgery at a time or place convenient for them, even if the recipient is not yet ready for a transplant or lives far away from them. If paired exchange is the best option for you and your recipient, you have 2 options. You and the recipient can opt to have surgery in the same exchange. Your kidney would be sent to another recipient, and your intended recipient would receive a kidney from another donor on the same day. From a logistical standpoint, requiring all surgeries to be on the same day is much more difficult to arrange. Even with only 2 donor and recipient pairs, this requires simultaneous donor availability, recipient readiness for transplant, and transplant center availability for pairs identified as a match. Therefore, this scenario may take additional time, meaning that you may wait much longer for this option. Voucher donation is the alternative that provides much more flexibility and allows us to prioritize optimal matches. With voucher donation, you donate in advance of the recipient's surgery and specify the recipient as a voucher holder. This voucher can be activated for the recipient anytime after you donate when they are ready for a transplant. This could be weeks, months, or years after your donation. A good question is, what if the recipient doesn't use the voucher? For example, if they receive a deceased donor transplant or become too sick for transplant. They can remain a voucher holder in case they need and are ready for a transplant later on. And you can also name 4 other people as backup voucher holders. Even though 5 people can be listed on the voucher, it is important that it can be redeemed only once. Just as paired exchange revolutionized living donor kidney transplant 2 decades ago, the voucher program has taken living donation to the next level. By increasing flexibility of living donor transplantation, we are able to achieve better immunologic matches for recipients, allow donors to have surgeries at a time and location more convenient for them, and increase the donor pool in order to successfully transplant hundreds more patients in the United States. As a voucher donor through the Paired Exchange program, you will have several benefits available to you. Your donor coordinator can review up-to-date program-specific information, but these programs include lost wage reimbursement for your post-op recovery time, financial assistance for travel and dependent care, mentorship programs with other living donors, and legal protection if you ever face discrimination related to donation. Lastly, in the extremely rare circumstance that you would ever need a kidney transplant in the future, voucher donors are prioritized for a living donor transplant. We strongly recommend that all our paired kidney exchange donors to voucher donate, given these benefits to both you and your intended recipient.
Thank you for considering the life-saving gift of organ donation. To find out more information about living donor kidney transplant at Piedmont, visit piedmont.org/livingdonor.